right, hello there. It's Dr. Daniel Hockenberry with Ried Physical Therapy. So today we're going to be going through another one of our frequently asked questions, which today it is, what role does strengthening and flexibility play in managing and preventing shoulder pain? So this question's pretty crucial because it involves some of the things that we actually do here at Ried, but it also is kind of a way that we're able to work on these things even at home on our own. So strengthening and flexibility are really important because often with shoulder pain, we actually are missing out on some pretty big components that lead to having more of these shoulder pains. So one of the biggest components is that our shoulder blades themselves, we often don't think of them as being their own joint. Often if we lack a bit of flexibility or motion in that area, it can lead to us kind of compensating where we have to hike our shoulder when we're elevating it, where we're kind of completely relying on this outside bone, the humerus, to do all that work. We actually need our shoulder blade and the humerus to work together. So what that involves is actually having improvements in the flexibility in both regions so that we're actually not just relying on one versus the other, which can actually lead to dysfunction. And then regarding strength, we need to build strength around the surrounding area. So a lot of times our shoulder blade, that area that helps with our posture, helps pull all of our muscles back, we often have a lot of weakness in that area. What that leads to is that we often compensate using different muscles, which actually can potentially lead to further injury down the road. If we're not actually working on the whole area surrounding the shoulder, so often we think of just doing the front muscles here, so the deltoid, the traps, we think of those as being our shoulders muscles, and the rotator cuffs, of course. And strengthening all those things and stretching in a lot of those areas are really important, especially stretching the front part. But if we aren't getting a lot of stability in the back part of the shoulder, it actually would be just strengthening things in a more dysfunction state. We actually need to build a more total strength in the area in order to allow it all to work together. That's just one simple way that we can actually, the strengthening and flexibility can kind of work together to either manage or reduce that shoulder pain.